Hello, it's Dr. Rhonda Johnson. Today is Wednesday, June 21st, 2023, and today I'm talking about physician, biomedical, and scientist harassment on social media during the COVID-19 pandemic. Well, a group of researchers led by doctors and scientists from Northwestern University, and they collaborated with other institutions, published the results of a survey in the Journal of the American Medical Association Network on June 14, 2023, and I'll include the link. The survey captured the harassment on social media experienced by physicians, biomedical scientists, and trainees during the COVID-19 pandemic. Now, participants were recruited through Twitter. Inclusion criteria included they had to be U.S. residents and self-reported profession as a physician, biomedical scientist, or trainee. Participants self-reported their demographic information such as age, gender, race, and ethnicity. Now, there were 359 respondents who met their study requirements, and the responses were collected from July 18th to August 21st, 2022. So what were their findings? Very interesting. 66% reported harassment on social media, and 88% reported that they had been harassed due to their advocacy. Now, respondents also reported harassment on the basis of their gender, their race or ethnicity, their sexual orientation, disability, and religion. Now, the topics that generated the most harassment included public health messaging, information about the COVID vaccines, abortion, firearm safety, racial inequity, LGBT, and transgender advocacy. Now, some physician survey that wrote in comments that their practices were given negative health reviews online by anti-vaxxers, and some respondents reported that they received death threats and other threats of violence and intimidation. The net result for one survey respondent was, I quote, "I use social media less. I found it was too draining for me and my mental health was suffering." Now, we all know that social media clearly can play a very important role in communicating educational, scientific information, health information, news, all kind of information. However, the authors of this study concluded that high levels of reported harassment may lead more physicians and scientists to limit the way they use social media, thus leaving propagation of misinformation unchecked by those most qualified to combat it. What do you think about that? I certainly know that I have experienced harassment on social media, although I did not participate in the survey. Now, I also think it's very important to combat misinformation. And it's ironic because just on Sunday, June 18th, my message was on how misinformation spreads. And I'll just remind this audience that evidence-based research shows the more misinformation gets shared, the more likely it is to be believed. And the longer that misinformation circulates, the higher the probability is that it will be considered to be truth. That's why it is so important to quickly tag misinformation as untruth, or in common words, lies. But I realize there's a point where the personal cost of trying to do this work is just too high. And I certainly respect those who choose to cease their educational outreach on social media. Again, I'm interested in your thoughts. Be sure to comment and take care, folks, and stay well.